The first sentence you say in a doctor's office can change the direction of the entire appointment. It can make a symptom sound urgent or harmless. It can lead to more questions or end the discussion before it properly begins. And many older adults unknowingly use phrases that make serious symptoms sound smaller than they really are. I am Dr. Daniel Brooks, and this matters because doctors are not only listening to what hurts, they are listening to how you describe it. In a short appointment, your wording can influence which problem gets attention, which test is ordered, and which symptom is quietly pushed aside. This is not about blaming doctors. It is about helping you give clearer information so your doctor can make better decisions. Here are 7 things seniors should stop saying at medical appointments and what to say instead. The first phrase is, "It is probably just my age." This may sound reasonable. After all, the body changes with age. Energy may change, joints may feel different, recovery can take longer, but the moment you label a symptom as aging, you may close the investigation before it starts. Dizziness is not always age. Memory changes are not always age. Weakness is not always age. Loss of appetite, low mood, bladder changes, shortness of breath, and unexplained pain should not automatically be placed in the aging category. They can be caused by medication side effects, anemia, thyroid problems, infections, vitamin deficiencies, heart disease, kidney trouble, diabetes, depression, or many other treatable conditions. Imagine a 72-year-old woman who starts feeling dizzy when she stands. She tells her doctor, "It is probably just my age." That sentence makes the dizziness sound expected. But what if her blood pressure medication is lowering her pressure too much? What if she is dehydrated? What if she has anemia or an irregular heartbeat? The symptom deserves to be described before it is explained. So instead of saying, "It is probably just my age," say, "This started 3 weeks ago. It happens when I stand, and it was not happening before." That gives your doctor something useful: when it started, when it happens, how it has changed. Your job is to describe the symptom. Let your doctor decide whether age is part of the explanation. Now the next phrase sounds polite, but it can be dangerous. "I do not want to waste your time with something small." Older adults often say this because they do not want to complain. They know the doctor is busy. They have spent a lifetime handling discomfort without making a fuss. But you are not wasting your doctor's time by reporting a new symptom. That is the purpose of the appointment. A new lump, unexplained weight loss, blood in the stool, a change in bowel habits, persistent fatigue, or a cough that will not go away may feel small at first. Serious conditions often begin with quiet symptoms. If you minimize the problem before you describe it, your doctor may spend less time exploring it, not because they do not care, but because short appointments require constant decisions about what needs immediate attention. Do not grade the symptom yourself. Say, "I have noticed this change, and I want to understand what could be causing it." That is not dramatic. It is accurate. Now, stay with me, because the next phrase can pull the entire appointment toward the wrong diagnosis. I looked it up online, and I think it is just this. Researching your symptoms is not wrong. It can help you learn useful medical words and prepare questions. The problem begins when you arrive with a final diagnosis. You may say, "I think this pain is just arthritis," or "I am sure this is a pinched nerve." Once that idea enters the room, both you and the doctor can become anchored to it. Other explanations may receive less attention. Shoulder pain may be arthritis, but it can also come from the neck, a tendon injury, or in some cases the heart. Frequent urination may be age-related bladder trouble, but it can also be diabetes, infection, medication effects, or prostate disease. A better way to use online research is to ask a question instead of giving a verdict. Say, "I read that this can sometimes be connected to nerve damage. Could that apply here, or are there other causes we should consider?" That keeps the diagnostic process open. Now the fourth phrase is common after blood tests. "I feel fine, so the numbers probably do not matter." This is one of the most dangerous assumptions in senior health. Many serious problems produce no symptoms early on. Kidney function can decline quietly. Blood sugar can rise for years before a person feels ill. High cholesterol usually causes no warning at all. Thyroid changes may be blamed on age. Anemia may develop slowly enough that the person simply adjusts to feeling tired. The fact that you feel fine is good, but it does not automatically make an abnormal result harmless. The right response is not panic, it is asking better questions. What does this result mean? Has it changed since my last test? Should it be repeated? What can I do now? At what point would treatment be needed? One number may not mean much by itself. The trend often matters more. A kidney result that has changed slowly over several years tells a different story than one isolated reading. So do not dismiss a result because you feel normal. Early disease is often easier to manage precisely because the person still feels well. Now, this next phrase sounds respectful, but it removes something your doctor needs. Whatever you think is best? Your doctor brings medical training, but you bring information about your life. The best decision needs both. Suppose there are two treatments. One works faster, but causes more side effects. Another works more slowly, but is easier to tolerate. Your doctor needs to know what matters most to you. Do you live alone? Are you caring for a spouse? Do you need to keep driving? Are you worried about dizziness? Have you had a bad reaction to a similar medicine? Can you afford the treatment? Will you realistically follow the plan? A treatment can be medically effective and still be wrong for your life. Instead of saying, whatever you think is best, say, what are my options and what are the benefits and risks of each? Then add your priorities. I want to avoid anything that increases my fall risk. I care for my husband and cannot manage a long recovery. I am willing to try medicine, but I am worried about stomach problems. This is not challenging your doctor. It is giving them the information needed to choose wisely. Now the next phrase can cause a useful treatment to be abandoned too quickly. I already tried that. It did not work. Maybe it truly did not work, but your doctor needs details. How long did you try it? What dose did you take? Did you take it every day? What side effect made you stop? What result were you expecting? Physical therapy done twice is not the same as a full program. A medication taken for a few days may not have had enough time. A dietary change followed during the week but abandoned every weekend may not have been a fair test. And sometimes a treatment failed because the dose was wrong, the diagnosis was incomplete, or another condition was interfering. Instead, say, I tried that for 3 weeks at this dose. It reduced the pain a little, but it caused dizziness, so I stopped. That tells the doctor exactly what happened. Now they can decide whether the treatment failed, whether the dose was wrong, or whether another option would be safer. This brings us to the most important phrase on the list. I did not want to bother you, so I waited. Many older adults wait because they do not want to seem anxious. They wait because transportation is difficult. They wait because they hope the symptom will disappear. They wait because their family is busy. They wait because they are afraid of what the doctor might find. But waiting does not freeze a medical problem. Time continues inside the body. A small skin change may grow. Shortness of breath may slowly worsen. A bowel change may continue for months. A breast lump may become larger. Weakness may lead to a fall. Blood in the urine may appear only once and then disappear, even though the cause is still present. Early care often gives you more choices. Later care often gives you fewer. You are not bothering your doctor by reporting a new symptom. You are giving them the chance to investigate it while it may still be easier to treat. Now, not every ache needs an emergency appointment, but certain changes should not be delayed. Unexplained weight loss, blood in the stool or urine, a new lump, chest pressure, breathlessness that is getting worse, a new change in memory or personality, weakness on one side, repeated falls, a wound that will not heal, a major change in bowel or bladder habits, a symptom that keeps returning or steadily gets worse. These are not complaints, they are clinical information. Now, let us make your next appointment more useful. Before you go, write down your 3 most important concerns. Do not bring a list of 20 problems and hope the doctor can cover everything in a few minutes. Put the most serious or newest issue first. For each symptom, write 4 details. When did it start? How often does it happen? What makes it better or worse? How is it affecting your daily life? Instead of saying, my legs feel strange, say, for the last month, my right calf hurts after I walk for 5 minutes. and the pain stops when I rest. Instead of saying, I am tired, say, for 6 weeks, I have been falling asleep in the afternoon and can no longer finish my usual walk. Specific details lead to better questions. Bring an updated medication list too. Include prescription medicines, pain relievers, vitamins, sleep aids, and herbal products. Doctors cannot identify an interaction if they do not know everything you take. And if you sometimes forget what was said, bring someone you trust or write notes during the visit. That is not a sign of weakness. Medical conversations move quickly. Before you leave, ask one final question. What should make me call you sooner? That tells you which warning signs matter and how long you should wait before following up. Now, I want to be clear about something. You do not need to become aggressive to receive good care. You do not need to argue. You do not need to arrive with a medical textbook. You need to be clear. Do not minimize. Do not diagnose yourself. Do not hide what matters. Do not agree to a plan you do not understand. And do not wait for months because you are afraid of being a burden. A doctor cannot investigate a symptom they never hear about. They cannot adjust a medicine if they do not know it makes you dizzy. They cannot choose the right treatment if they do not know your priorities. They cannot catch something early if you introduce it late. I am Dr. Daniel Brooks, and the most important message is simple. You are not wasting anyone's time by speaking clearly about your health. Your symptoms matter, your questions matter, your preferences matter. And your appointment is not the place to be polite at the cost of accuracy. At your next visit, replace "it is probably just age" with "this is new." Replace "I do not want to waste your time" with "I need help understanding this change." Replace "whatever you think is best" with "what are my options?" And replace "I did not want to bother you" with "I noticed this early, so I came in." Those small changes can lead to better conversations, earlier testing, safer treatment, and care that fits your actual life. Everything shared here is for general education only and does not replace personal medical care. If you develop chest pain, severe shortness of breath, stroke symptoms, fainting, heavy bleeding, or a sudden major change in your condition, seek urgent medical help immediately.